This lecture is from Chapter 4, and it is on substance use and abuse, which is also an alteration of consciousness, which is what Chapter 4 discusses. Again, Chapter 4 discusses the concept of consciousness, and as we know, the use and abuse of a substance affects your level of consciousness. So we'll discuss what a substance use disorder is, and then several different substances and how they affect us as humans. So let's define substance use disorder. When do we know it's a disorder? The person uses more of the substance than they originally intended to and continues to use that substance despite experiencing significant adverse consequences. We know that substance abuse includes a physical dependence. In other words, physical withdrawal symptoms are experienced when they stop using the drug. For example, withdrawal from alcohol can include headaches, nausea, tremors, and several other side effects. There's also a psychological dependence. Psychological symptoms are experienced again when they stop using the drug. Psychological withdrawal from alcohol could include anxiety, insomnia, and hallucinations. So let's look at some specific drug classes now, their short-term and long-term effects. Depressants are the first class of drug we'll look at. Depressant substances reduce arousal and stimulation. They affect the central nervous system, which we know consists of the brain and the spinal cord, slowing down the messages between the brain and the body. They can affect concentration and coordination and slow down a person's ability to respond to unexpected situations. In small doses, they can cause a person to feel more relaxed and less inhibited. However, in larger doses, they can cause drowsiness, vomiting, unconsciousness, and even death. Alcohol and barbiturates, which can be used to treat insomnia and seizures, and benzodiazepines, which can be used to treat insomnia and anxiety, are depressants. So barbiturates and benzodiazepines can be used under medical supervision in a positive way. Now that we've looked at depressants, let's take a look at the opposite drug class, which would be stimulants. The immediate psychological effects of stimulant administration include a heightened sense of well-being, euphoria, excitement, and alertness, increase in motor activity similar to what would be seen in a manic state. Stimulants can also reduce your appetite and may result in not being able to sleep or insomnia. Stimulants may also enhance focus and libido. High doses, particularly when you're sleep deprived, may result in restlessness, agitation, and more profound psychiatric presentation, including altered perception of reality and hallucinations. Chronic psychological effects of stimulant use and withdrawal may include paranoia, psychosis, depression, and/or suicidal ideation. Some examples of stimulants include cocaine, amphetamines, MDMA or ecstasy, and believe it or not, nicotine and caffeine are considered stimulants. So let's look at a couple of those. Let's look at cocaine first. When it's snorted or smoked, cocaine causes a rush of dopamine, a neurotransmitter, which we discussed neurotransmitters in earlier PowerPoints, a neurotransmitter that regulates the pleasure and reward centers of the brain. So that rush results in an intense euphoria lasting anywhere from a few minutes to an hour, depending on how much cocaine is consumed. Unfortunately, this high comes at a higher cost, with a wide variety of short-term effects that may include restlessness, agitation, increased heart rate, raised blood pressure, and even tremors, seizures, or heart attacks. Let's look at caffeine now. I wanted to look at caffeine because I think it's such a common stimulant that probably all of us have used consistently or have used. When it reaches your brain, as you can imagine, the most noticeable effect is alertness. You'll feel more awake and less tired, which may help with processing speeds and memory, suggesting that moderate intake may actually help with cognitive function. However, when caffeine is consumed excessively, it can lead to cognitive side effects. For example, too much can cause headaches, Withdrawal from caffeine can also cause anxiety, irritability, and insomnia. The next class of drugs we'll look at is opioids. Opioids can be naturally occurring. For example, heroin and morphine are derived from the opium poppy, or it could be synthetic, which simply means it's created in a lab to mimic the effects of naturally occurring opioids. They're commonly used for the treatment of pain and include medicines such as morphine, fentanyl, and tramadol. Their non-medical use, however, and prolonged use and misuse can lead to opioid dependence. Opioid use can lead to death due to the effects of opioids on the part of the brain which regulate breathing. Some examples of opioids include heroin, morphine, methadone, and codeine. Let's look at heroin. Once heroin enters the brain, it is converted to morphine and binds rapidly to opioid receptors. People who use heroin typically report feeling a surge of pleasurable sensation, or what you might refer to as a rush. The intensity of the rush is a function of how much drug is taken and how rapidly the drug enters the brain and binds to the opioid receptors. With heroin, the rush is usually accompanied by a warm flushing of the skin, dry mouth, and a heavy feeling in the extremities. So let's look at the long-term effects of heroin use. Repeated use changes the physical structure and physiology of the brain, creating long-term imbalances in neuronal and hormonal systems that actually are not easily reversed. Studies have shown there is some deterioration of the brain's white matter, which may affect your decision-making abilities, the ability to regulate your behavior, and your responses to stressful situations. So lots of negative side effects long term. The next class of drugs we'll look at is hallucinogens. They result in profound alterations in sensory and perceptual experiences. In some cases, users could experience visual hallucinations. It's also common for these types of drugs to cause bodily hallucinations. For example, feeling as if you are a giant, and also a skewed perception of the passage of time. Long-term effects of usage may include intrusive flashbacks and psychosis, which can occur in some people even after using the substance only once. Drugs in that class include LSD and PCP. LSD is a psychedelic drug, which means it can affect all your senses and alter your thinking, your sense of time, and your emotions. It can cause you to hallucinate, seeing or hearing things that do not exist or are distorted. PCP is also hallucinogenic, sought for its ability to induce the illusion of euphoria, omnipotence, superhuman strength, and social and sexual prowess. So that's just a quick review of what a substance use disorder is defined as and what several different substances do to your body, the short-term and long-term effects. If you have any questions, as usual, please let me know.